myself Dr.Anandi, MS DGO. I am gold medalist in DGO. I am specialized in infertility. I am practicing in infertility for the past 15 years. I have undergone specialized trainings in infertility from the pioneers in this field like Amit Patki sir from Mumbai and Ramaraju sir from in Vizag, and the legends in this field, Dr. Kamini Rao ma'am from Bangalore and Kamala Selvaraj ma'am from Chennai. When I started my practice by around 2003, more than 90% of my OP patients will be infertile couple. So at that time there was an increasing trend in the infertility because of the unhealthy food habits and the modern lifestyle. So which inspired me a lot, and that's how I got or I decided to do the specialization in this field. So I selected this field as my specialty. This when I saw the infertile couples, and when I used to attend a lot of infertility conference. At that time, the mastermind is Dr. Kamini Rao ma'am. After seeing her only, I got inspired and I discussed this with my husband. He only gave me the lot of moral and the all the support to me to start the center.
How many beds are available over the operation theatre and the
Yeah. We are having a modular theatre, twin theatre, and my IVF modular IVF lab with the 25 to 30 beds. Myself and my husband are the main consultants. We'll be having 15 more consultants are visiting our hospitals. We are having 10 to 15 nurses. We are focusing mainly on the women health, starting from our treatment protocol. Even we are starting from the adolescence period, because the adolescent obesity is the main threat nowadays, which is the main cause for the all the menstrual irregularities and the infertility problems which they are going to face in their future life. So we are advising, when the adolescent girls we are focusing on mainly on the adolescent health by giving a proper guidance how to maintain their weight, and by giving them a balanced, how to follow the balanced food diet chart, and practicing. We are focusing more to practice yoga, where you can enhance your cerebral capacities and increase your mental ability. And we are also advising those girls to take or undergo any one of the classical music or dance or practice any martial arts. That way we can transmit that to the next generation babies. Okay. Then after the adolescent period, when they enter into that time itself, we will be asking them, or will be advising them, when you are entering into the pre-conceptional period or when you are in that period, they will be coming to us for the pre-conceptional counseling. At that time, I'll be focusing we will be focusing more on how to maintain before their pregnancy, what should be their thyroid level, what should be their blood pressure level, what the weight they have to maintain, what the blood sugar level, because the rising incidence of diabetes and the GDM, we will be giving a lot of health protocols to maintain all this, and whether they are immunized before they are getting pregnant and all. Then after this preconceptional counseling, if they enter into the pregnant period, we will be giving a proper antenatal care with all our, we are having 4 to 5 consultants here. We are handling all the high-risk pregnancies. So most of the high-risk pregnancy people will be having the high-risk pregnancy patients only. So with the proper antenatal care and with the good, with the proper antenatal care, we are making the patients to understand, because nowadays, the autism and the learning disability, everything is, they say one of the cause for those problems is the antenatal depression and the stress where these patients are undergoing during the antenatal period. So we will be focusing how these patients to be kept in their family joyfully, what are the things they should speak, what are the things they should see, how to be happy, and how to all the micronutrients, how they should maintain their balanced any hemoglobin level or blood sugar level, thyroid level, which are going to help the development of the babies, where we can prevent the development delays or the autism or the learning disability children's. We can prevent the incidence to come a little bit lower, and also to produce a healthier babies, not only to build the healthier babies, and also to bring up the skillful, increase the skills in that babies. Immediately after delivery, we will be having one session how to bring up those child, how to increase their cerebral capabilities. Even now they are saying you should start teaching the kids even when it is in the 7 month of the pregnancy itself, and immediately after delivery we will be giving the so many what to say that kids and all they are providing. So we will be asking and we will be insisting our patients to teach that how to spend their time with the child, quality time with the child. Okay, then after the antenatal period, and even if they at the age of 40, if we are seeing the patients at 40, fit at 40 is our motto. So we will be doing extensive work on this cancer screening, diabetes screening, because my husband is a physician. So we are doing all this screening to have a healthy life in their 40s and all. This is how we are providing the health care, women health care in our hospital. But my specialty is, my vision and mission, everything is to provide best care to the rural infertile couples. We are focusing more on them to help them to analyze their problem, how to select appropriate treatment, ART treatment, how with the minimum cost. So we are practicing the low cost IVF in our center, where we are helping we are helping our rural infertile couples. And as per technology, if you see, we are having for all the peoples, even it's a rural people or if it's a well educated persons. What I follow in my center is, we are not having special counselors and all, or my staff nurse will not be handling that counseling session and all. I'll be having a one-to-one counseling. I'll be handling them personally. I'll explain in and out everything, whether they understood or not. I'll start from how the eggs are formed in the womb of a patient, and what is the egg reserve, what is the ovary, what is uterus, how the ovulation is occurring, how the egg is taken by the fallopian tube, how the sperm and the egg are fusing, how the genetic makeup is built up, how that genes are how the one healthy, how the womb is getting fertilized, what are the steps involved in the fertilization, how that one cell, one womb, fertilized womb is becoming an embryo, and when it will reach the uterus, how it is getting implanted, what are the factors, everything I will explain to my patients. Because as per nature's gift, the success rate, if we treat 100 patients, the natural success rate is only 30%. So we can enhance our success rate only from 30 to 50%, like that. We can't do magic or like 100%, we can't give 100% success rate in a single cycle. So we will be insisting, because they will be coming with a lot of expectations. IVF will be getting a definite baby and all. So I talk to them everything about what is the pregnancy, how the pregnancy is occurring. So how we are going to do IVF in our center. I will mostly I'll go for the blastocyst transfer. That means I'll be growing the embryos in my incubator till the 5th day, 5 days, and on the 6th day or at the end of the 5th day, I'll be transferring that blastocyst inside the uterus. If you'll be asking me, ma'am, that's only 30 to 50% success rate, then how those failure patients, what you'll be doing with the failure patients? So for that only, we'll be having the freezing programs. So we'll be doing the embryo freezing on the third day, or even if they are time permits, we'll be doing the fifth day blast freezing. And if once the patient is getting failure, then 1 or 2 months we'll be analyzing retrospectively what may be the cause for the failure and all. Then we will be doing this. We'll take this frozen embryo and we will be doing this frozen embryo transfer cycle. Thereby, where we can give a better chance within 1, 2, maximum 3 cycles, patients will be getting conceived. My next step, what we are planning is to bring this PGS and PGD. PGS is that's pre-implantation genetic screening and pre-implantation genetic diagnosis for the repeated failure patients, because now there are so many centers and the patients are all the failure patients. Repeated implantation failure patients are attending to us. So for that, what we can do, we don't know whether the embryo is in fault or there is a problem in the uterus. So to take care of the embryos, what we will do in that embryos, we will take a single cell out of the embryo and we will do a genetic test, karyotyping for that embryo, and if that embryo is genetically competent, then we will put that embryo inside the uterus of that failure patient. Otherwise, this we can do this PGS and PGD. We can help those patients who are having already the anomalous baby or mentally retarded child or congenital, the familial problem babies, if they are having any hereditary disorders and all. For those patients, we will be advising this PGS and PGD. It's the latest technical advancement in the field of infertility. The another thing that we are doing is the endometrial receptivity era. See, the infertility is nothing but it is like farming. A good embryo is the seed and the field is the uterus, and your blood and hormones are the water. So if everything is properly and if it is coordinated, if it is kept in a coordinated way, you will be getting the pregnancy. If any one of this is in fault, whether the embryo is in fault or the uterus, it's not yet receptive for that embryo. If you are putting that embryo at a wrong period, there will be no receptivity. So in order to check those, for the embryo we are having this PGS and PGD. If the embryo is okay, even after that also that patient is getting failure and all, we have to check the receptivity of the endometrium. That is the ERA, the endometrial receptivity ERA, or endometrial receptivity assay, where we will be taking the endometrium piece of the endometrium and we will send it to the lab for assessing the receptivity. Then if they gave me the report as this day is your endometrium receptive or that day is endometrium is receptive, means we will be planning to put the blast during that period. By this we can increase our success rate and we can help our infertile couples to get a successful pregnancy and to have a healthy baby and also a skillful baby, because my vision and my mission is mainly not only treating the infertile couples. I want my next generation, the child who are born in this hospital should not be suffering from any of the minor elements apart from the congenital or genetic problems. They should not suffer from any of this illness, the mental illness like that, the autism, learning disorders. If it's a element or the problems which we can take care during the antenatal period. So by combining the ancient wisdom, how one patient, pregnant patient should be treated in your house, how she should be kept joyfully. So in by treating that ancient wisdom along with the technology, I'm giving I'm doing my best to achieve a successful pregnancy to my patients.
Ma'am, do lower abdomen obesity affecting infertility?
Yeah, obesity is the main cause for infertility. That's why when I get a chance to see an adolescent girl, I'll be so happy because that is the time we can impart, we can do a lot because that is the time when their menstrual problem or irregularity is occurring mainly because of obesity. Because this obesity, what this obesity will be doing, the patient is obese, there will be increased level. First, you have to rule out whether there is a thyroid problem. So, this obese patient will be having an increased level of estrogen, and this will be, and there will be the association of insulin resistance. Okay, so this obesity along with the insulin resistance and the increased estrogen level and the increase in the LH level, all this is going to affect your ovulation. It will be affecting your eggs which are growing. It will not allow your eggs to grow, it will not allow your eggs to ovulate. So you will be having a small developing follicles arranged around the ovary. That condition is called PCO. Every other patient of the adolescents, if you see, they will be having one scan report as PCOD. The main base is the PCO is not only because of obesity, it's a genetic, environmental and your hormonal problem. So gene you can't change, but if it is due to the environmental or nutritional problems, we can take care of them by giving the proper guidance about the diet, exercise, ask them to do yoga, and by developing some, I told you know that dance and all, it will be helping these girls. And if we give a thorough knowledge at that time, these girls will be, you are going to be affected by the infertility. When you get married because of this problem, they will be definitely accepting that, and they are undergoing the correct treatment follow-up. They'll be coming. That is, if they are arranging for marriage, they will be usually coming to me and asking, ma'am, now I'm all right. How my ovaries are and what the things we have to do.